Exemplar, multiple sclerosis. Immune-mediated disorder of the central nervous system in which immune cells attack the myelin sheath around nerve cells. Translation: patient's own immune system breaks down the coating around the nerve cells that insulates them. This causes signals to be weaker. Results in a decreased transmission of nervous signals. So multiple sclerosis is an immune disorder, so that means that the immune system is attacking the central nervous system in which immune cells attack the myelin sheath around the nerve cells. Now, the violin sheath is kind of like the protective coating on your electrical cord, so it's going to keep the impulses within it, and it's gonna make sure you don't lose any of the impulses like to the air. So with that, when the Mylan sheath breaks down, it would be as if I stripped this cord and the wires were exposed, so you end up losing some of the signals, so by the time it gets to the next neuron, it's not as strong as it usually is, and this is what causes that weakness that they have. So pathophysiology: each axon, nerve fiber in the CNS, is covered by myelin sheath to protect the nerve and increase transmission of electrical impulses along neuron membranes. Cells of the immune system cross blood-brain barrier and attack and destroy myelin sheath. Demyelination results in inflammation and leads to formation of lesions. Repeated attacks on the myelin may result in scar tissue, which results in permanent damage. Axon damage and lack of myelin disrupts nerve impulses in the CNS. Neurological symptoms: multiple sclerosis, facts. Exact cause is unknown. Links to environmental, infectious and genetic factors. Virus exposure: Epstein-Barr virus causes this overreaction of your immune system. Affects nearly 400,000 people in the United States. Usually diagnosed between 20 to 40 years old. Childbearing years of women, so between 20 years old and 40 years old. So you can see how devastating it can be. You're trying to take care of your kids, you're busy in your career, and suddenly you're having all of these problems. Women. European. Women twice more as likely. European descent more likely. Diagnosis: clinical picture, differential diagnosis, and MRI to look for plaques, demyelinated nerves. Diagnosis is not something that you can do one single test to diagnose, so you need to look at the clinical picture. So you want to look at what kind of symptoms they're coming in with. You want to rule out differential diagnosis, so other things that look like the disease that you're ruling out, and then an MRI to look for plaques or the demyelinated nerves. Multiple sclerosis, manifestations. Common symptoms: fatigue, paresthesia, lack of coordination and balance, unsteady gait, tremors, bladder bowel dysfunction, visual disturbances, dizziness, diplopia, blurred vision, nystagmus, blind spots, sexual dysfunction, pain, headache, trigeminal neuralgia, cognitive dysfunction, lack of concentration, memory loss, poor judgment, muscle spasticity or weakness in one or more limbs. Multiple sclerosis, classifications. It can make it difficult for telling if your treatment is working because it progresses in 4 different ways. I just want you to have an understanding that not all MS patients are the same. Relapsing remitting. Most common, clearly identified flare-ups with worsening neural function followed by periods of remission, partial or complete. Primary progressive. Slow but steady continuous worsening of their disease from the time of onset. Rate of progression varies over time. Secondary progressive. Develops within 10 years of diagnosis and about 1/2 of clients with the relapsing remitting MS. Initially, client experiences relapsing remitting MS followed by a progressive form of disease. Progressive relapsing. Rare form, steady worsening of disease with acute relapses. No remission of symptoms between relapses. Beta interferons. Descent. Reduces the number of inflammatory cells that cross the blood-brain barrier, therefore reducing neuronal inflammation. Slows progression of disease. Give you less of an immune response. Reactions to injection area, liver damage, mood changes. Baclofen. Reduces spasticity. Seizures with intrathecal administration. Dizziness. Headache. Drowsiness. Fingolimod. Traps immune cells in the lymph nodes, making them unable to access the CNS. Traps immune cells in the lymph nodes, making them unable to access the CNS. Bradycardia.
Diarrhea.
Cough. And headache. Multiple sclerosis. Nursing care. Main goals: promote activity, prevent injury, maintain bladder bowel continence, safe swallowing eating, improve cognitive function, develop effective coping skills. Promote exercise, encourage walking, and use of assistive devices if needed. Minimize spasticity and contract yours. Walk with feet further apart. Frequent short rest periods. Avoid strenuous exercise, encouraging laying down for rest. Balance nutrition, healthy weight. Monitor weight, encourage cessation of cigarette smoking and consuming alcohol. Prevent complications of immobility. Coughing and deep breathing exercises, TNR frequently. Prevent injury. Coordinate social services, speech therapy, physical therapy, and homemaker services. Maintain bladder and bowel control. Encourage fluid every 2 hours followed by urination 30 minutes later. Encourage fiber intake. Enhance communication. Speech-language pathologist consultation. Enhance swallowing position. Client upright. Have suction equipment available. Evaluate correct food fluid consistency. Monitor for visual defects. Eye-body diplopia. Apply eye patch or covered glass lens. Strengthen coping skills. Stretch, hold, relax routine, muscle stretching exercises.